what's really the relationship between IBD and diet? Is the relationship that food is just passing through an inflamed colon and that triggers symptoms for people and makes them uncomfortable? Or is there more to that relationship with diet and IBD? Let's talk about it. We got a comment this week asking just that. So let's read the comment and then we'll share some of our responses.
Yeah. So the comment was, am I right in saying that around diet and IBD, it's more the fact the diet isn't going to make it or cause it to be worse? So it's like eating something is more like adding salt to a wound. It isn't the cause of it, but might not be a pleasant experience to an already sore and inflamed colon. Good question.
Yeah. So a lot to unpack there. Let's start with the first part about what's the evidence around diet making things worse or causing it. So, with IBD, if we're talking about causes, the causes are multifaceted. We've known that there's a lot. It's not just one thing, it's a combination of things that can cause this environment where IBD is more likely to happen. So things that can increase the risk of it. Diet is a part of those factors, but it's not the only factor. And so I think that's an important context to remember. So, some of those factors are antibiotic exposure. So the amount of antibiotics that you have, we think could be a part of creating that environment where IBD is more likely to happen. There could, certain dietary factors can increase the risk of someone getting IBD. So we know that that's true. And, there's a lot of things, even just within those two, that some are out of our control and some are in our control. The out of our control factors are, there's like socioeconomic status. There's, your health and diet growing up. Some of that you didn't have control over. Your parent did. It played a big role in that. And so there's a lot of different factors within that play into someone getting IBD. So there's not one single cause. And in saying that, it's not just diet is what I'm saying that can perpetuate or cause IBD. There are a lot of different factors at play. And, within that too, it's not your fault either, because even if it was the only factor, that doesn't mean that you caused it, because there's a lot of outside of our control things at play.
Yeah, like the immune response.
The immune response. Yeah, there's so much we could say about that. And then could it make it worse? Yes, we do know that dietary patterns can make IBD worse or can increase your risk of flare-up. And we also know that there are dietary patterns that can decrease risk of flare-up. So that's important to know as well. So yes, they can play a role in that picture. And it's not just about whether or not something triggers symptoms. It's more about kind of what we know from the research as a whole, just looking at things that can increase the chance of inflammation and increase the chance of an environment where flares can happen more often.
Yeah. I feel that sometimes people can get caught up in what causes what, whereas that can be a very difficult place to be in because, like you said, Ashley, it's that perfect storm that has to occur for IBD to take place.
Yeah.
What will happen?
Yeah, and I feel like we say this all the time, but we still get messages where people are like, "Oh, that's the first time I've ever heard that." But it's important to remember that tracking all the time your symptoms is not really a great first starting point when it comes to figuring out what matters with IBD, because symptoms can very much be misleading. There can be things that are gut friendly and helpful for your IBD, but you might be still symptomatic to it. And that's just, symptoms just do not equate inflammation or risk. It doesn't equate to risk of flare up. They're not the same things. And there can be other things. Let's say if your whole diet was like fast food and soda, that maybe you don't notice symptoms right away with it, but it does increase your risk significantly if that becomes a predominant part of the diet. So it is important to distinguish that there are these contexts that we're speaking about this within. And let's look at the other part of the question too. Did you have something else you wanted to add?
I think just always stressing the importance that, again, like it's pattern over plate. Meaning if we have one fast food item sparingly. It's very different than fast food fast food items every single day with absolutely no fiber in our diet.
Mm-hmm.
There's a
Yeah.
big difference. So I just want to reiterate that. But then, yes, the next part of the comment discussing diet isn't the cause of it, but might not be pleasant to an already sore, inflamed colon. Is that true?
Yeah, that's a part of the overall IBD picture. Like, and what's interesting is if you're someone with UC where a lot of the bowel is involved, or Crohn's where more of the bowel is involved, you're probably going to have more symptoms, like more of the diarrhea symptoms and that sort of thing. And if you're someone where more of the small bowel is involved and less of the, you can also be somebody that that doesn't have a lot of those symptoms. Maybe has more of the fatigue picture, or maybe bloating. So some of it can depend on where your disease is located and what you have going on, what's actually going on when you look at it. But yes, I think to a degree, yeah, there's things happening with IBD that create this environment where symptoms are more likely to happen. So you're more likely to have more pain, more bloating. A lot of times, a lot of pain can come from bloating, and bloating can come from, even just your gut environment. So like gut microbes, your whole gut environment is based on the things that we eat play a big role in the gut environment. So what your gut bacteria consume. So, and then this is how dietary patterns play a role in risk, for example, is how we're feeding up our gut microbes. And then that plays a role in the type that are present and growing in population, which can play a role in symptoms.
Yeah, absolutely.
Yeah. So it's kind of one of those yes and things. Like, yes, absolutely. Symptoms can occur just from having IBD. And it's, the aspect of what's going on in the microbiome, and that can perpetuate bloat. Like, yes, all those things are true. And food is also going through your gut and playing a role in your gut microbiome and in your symptoms long term. So it's a yes and for me with that question.
No, it's not. Again, you've heard us say this before, but it's not black and white when it comes to nutrition. And we can always dive deeper with things. But I guess stressing the importance of nutrition, but just that it does play a big role for people and help mitigate symptoms. It has a role in anti-inflammatory support for the body too. And that can't be forgotten about.
Yeah, absolutely. And I think when people hear that it plays a role in symptom reduction, I think the immediate thought is, oh, so that means like taking out foods. But it's not actually what we're talking about there. When we talk about mitigating symptoms, we're often talking about what can we add? What will we add to someone's treatment path that will help with reduction of symptoms? So what are the things we know that have research behind them that can help with bloating reduction or with diarrhea, or that's what we're talking about when we say symptom reduction. So a lot to think about with that question, but know that, there's a lot more to the question than really we could answer on Instagram. So we thought it deserved its own YouTube video. All right. Take care, everybody.